Next, inspect these areas, which should have no obvious lymph nodes, edema, erythema, red streaks, or lesions.
Now I'm going to press lightly on a few places in your head and neck.
Now use the pads of your 3 middle fingers to palpate these areas. Plan to move the skin over the lymph nodes, pressing lightly at first and gradually increasing the pressure. For the head, follow this sequence and palpate the occipital nodes at the base of the skull, post-auricular nodes over the mastoid process, preauricular nodes in front of the ear, parotid and retropharyngeal nodes at the angle of the mandible, submandibular nodes between the angle and tip of the mandible, and submental nodes behind the tip of the mandible. For the neck, follow this sequence and palpate the anterior cervical nodes at the sternocleidomastoid muscle, posterior cervical nodes along the anterior border of the trapezius muscle, posterior cervical nodes deep to the sternocleidomastoid muscle, and the supraclavicular nodes, pressing deeply in the angle formed by the clavicle and sternocleidomastoid muscle. In healthy adult patients, lymph nodes usually are not palpable. However, you may detect small, movable, discrete nodes. If you find enlarged lymph nodes, characterize their location, size in centimeters, shape, consistency, tenderness, discreteness, and movability or fixation to surrounding tissue. But remember that a young child may have small, firm, discrete, and movable nodes as a normal finding, especially in the occipital, post-auricular, and cervical chains.